you got a lot of good insight. I'm going to come back to the dentist in particular. So it was a you had a decompression machine, and then
Correct.
you were using you recognized the herniated disc. I'm just kind of curious on like the specific therapies for the herniated disc that you were able to resolve. And then what was like what's the result? Like what was his life now after this?
Well, great question, because when it comes down to what's his life like, the herniated disc will never completely heal by just doing decompression. All we need to do is pull enough to get that herniation to come off of the nerve. That's the main thing. I would never lie to a patient and tell them, I'm going to be able to resect that disc completely back into where it's supposed to be, and you'll never have a problem again. I've never, ever said that, because it's not true. What my goal is to help you function better. Over 50% of the people, the population over the age of 50 that are walking around that are asymptomatic, meaning they have no symptoms, are walking around with herniated discs. They don't even know it. Why? Because that disc is not causing direct pressure on a nerve root. As long as there's a little bit of space, and that's what we're trying to create. We're trying to create space between the herniation and the involved nerve root that's causing that sciatica. When we do that, and then we start strengthening the muscles that those nerves are supporting, that's where we get the real home run. And the dentist that came in from Sarasota, was getting some relief from the decompression, but then he'd get back in his car and drive an hour home. And, it was kind of like diminishing his return on his investment. So we actually coupled that with the chair. And after his first treatment with the chair, the magic chair,
Mhm.
he walked in in his flip flops. He's retired, and he comes in. He's a barreling kind of guy, strong little guy, and he's looking at me with this grin on his face. He comes up to me, he goes, "You," and he picks me up. He lifts me off the ground. He gives me a kiss on the cheek. He goes, "I don't know what you're doing, but I want to sit on that chair again," because he was getting such great results, and it was so cool to see this type of result that's happening. And it's something that I'm sharing with most of my patients. I tell them, listen, if you really want to kick this sciatica out, let's get you on the magic chair, on the Mcella.
Wow, that's
It's really
amazing.
cool.
Well, I think I would like to just know a little bit more like this magic chair. I'm sure everybody else is going to want to know like what's the technology behind it, what's the secret, and like what's it's doing, because obviously a man barreling in and
Yeah.
picking you up, that's a great testimonial is what that is.
And that was after his first treatment. That was pretty outstanding.
Yeah, it's amazing.
So the Mcella chair is a chair manufactured by BTL Industries. It's a chair that was originally designed for pelvic floor health for females, but over the past 7 years, more and more clinical tests have shown that this device is able to help men with erectile dysfunction, men that have urinary urgency, that have challenges holding their urine throughout the night, or leakage. It's also helped assist with pelvic floor health as it relates to lubrication of a woman as she's getting older, so that relations are not as painful and the sensitivity increases. Why is all of this happening? It's because of the energy that's going around the sacral plexus, which is that pelvic floor, the nerves that come out of the sacrum that envelop the pelvis, and then some of those nerve roots are going to the organs of reproduction, the urinary bladder, the reproductive organs, going down nerve roots, transmitting into the sciatic nerve, going through into the legs. So everything that's happening in your legs is coming from that region. You know, you're seeing a machine that's able to push almost 3 Tesla. I believe it goes up to 3.1 Tesla, the strength. That energy is really energizing those nerves. It's making muscles fire 11,000 contractions in a 28-minute period. It's insane. And they are supramaximal contractions, meaning that you can try to do like a Kegel exercise, and you're only going to be able to fire that muscle at approximately 60% of its potential. The machine can fire at 100% involuntary muscle contractions. but they're at full action potentials. And the scientists at the company at BTL have determined what's the best firing rate, what's the rest needed, fire it again, rest needed, so that they can fatigue that muscle. And they're basically giving your pelvic floor a workout. You're getting a pelvic floor workout by sitting on a chair, reading a magazine, or on your iPhone for 28 minutes. That region is energizing and sustaining function of the sciatic nerve. So I actually have a patient, let's say they have a right side sciatic nerve. I've decided, let's put that patient in a relaxed position to where the magnet, because the area of focus, the therapeutic area is approximately 4.5-inch diameter region where the Tesla coil is pushing up through the pelvic floor. So instead of just working the pelvic floor, if somebody's got sciatica, I will have them switch over to that side and put that coil right over the sciatic notch and where the piriformis muscle comes through and overlays the sciatic nerve. So we'll put them on there, and it's amazing the results that we're getting with sciatica. It's truly an amazing chair. It's like nothing else.
And it's really cool because a lot of people, like myself included, think that sciatica has it has a certain type of treatment, right? It's a nerve issue. It's about separation. And I never think about like other tools. Like myself, I've had that sciatica where you were explaining it goes down like past my knee and it went all the way down to like just the tip of my foot. And so I remember experiencing that pain and, just candidly feeling kind of helpless about it because there wasn't anything to do. Like stretching somewhat helped, working somewhat helped, but it would just come back with a vengeance. And it really interrupted my day. And I was just living with pain, in the 4 to 5 range, it wasn't exactly ideal. So something like that is not even my awareness of somebody that's been in sports, played. And I just think that's really amazing to see. How long has that technology been around?
Before I get there, I want to ask you something. How'd that make you feel, that pain? Young?
No.
Old?
Oh, very old.
It did, didn't you?
Yeah, absolutely.
Pain is subjective, but what it does to your life, it's really amazing when people experience pain, how it basically screws with your brain. It really makes your life miserable. And it's amazing to see how technology, when used properly, can really help bring you back. Because, as you were talking about that, I'm thinking, isn't it amazing how our bodies work constantly? When everything's going right, you don't feel a thing wrong. You're able to function. You're able to walk at a moment's notice. You can jump. You can move. When you play sports, you feel more alive than ever. I remember when I played soccer, those soccer players, they're gods, man. They really are. Those track stars, they're gods. We look at the Olympians. They're moving like they're angels, and here we are. When we have pain, it shuts us down. And we're sitting there looking at the Olympics. We're looking at these titans of sports. We're looking at these gladiators. We've always admired them. But when a gladiator's hurt, they'll go through any means necessary to restore their performance, their function. And that's what I've involved in my clinic, machines to get people back to functioning so that they can think about what's really important, their family, their life, their relationships, enjoying the work they do, not the darn pain that they have to deal with. It slows you down. It makes life miserable.